Please excuse any mispronunciations by TTS. The English TTS has trouble with non-English words. But, if you watch Cynthia, you should be fine. As a result of YouTube's rules pertaining to links in descriptions, I will be adding site details to the video. Wikipedia is a platform that can be created and altered by the general public. Any details from Wikipedia should be taken with a grain of salt. Iron Mouse is a Puerto Rican-American VTuber, singer, and Twitch streamer. Active since 2017, she is a founding member of the VTuber group V. Shoujo, launched in 2020. In 2024, she became the most subscribed Twitch streamer of all time, surpassing Kai Cenart's first record during a September 2024 subathon, before being surpassed herself by Cenart during a November 2024 subathon. Career. Iron Mouse originally planned to pursue a career as a coloratura soprano opera singer, but was diagnosed with common variable immunodeficiency, an immune disorder that has left her largely bedridden and isolated. It has also led to a lung infection called Mycobacterium avium complex, as she revealed to Project Melody in 2021. This required her to remain isolated from others, a situation which intensified in 2020 amid the onset of the COVID-19 pandemic. In 2017, she began to pursue a career as a streamer instead, as she was lonely and wanted something to do. Hesitant to use her real face online, she was inspired by the Japanese entertainer Kitsune AI, the first YouTuber to refer to themselves as a virtual YouTuber to stream with a digital avatar to conceal her identity. Her username comes from the villain Sailor Iron Mouse from the manga series Sailor Moon. After discovering that there were a growing number of users referring to themselves as VTubers like Kitsune, she began to consider herself one. The Iron Mouse persona was expanded into a character, which she referred to as a bigger version of me, and being like a superhero costume. Her avatar usually takes the form of a horned demon with pink and purple hair, while its backstory influenced by her having jokingly referred to herself on stream as such suggests that the character is a personification of Satan itself. Iron Mouse's distinctive, high-pitched speaking voice is the result of a lung infection due to COVID complications, which also resulted in her being on oxygen support 24/7. She has remarked that some people have refused to take her seriously because of her voice, and that some fellow streamers have been shocked to find out that it was her real voice, and not being manipulated with a voice changer. Amid a growth trend for streamers in general, and especially VTubers, Iron Mouse's audience on Twitch began to see increases over 2020 and 2021. The increasing revenue from her streams also allowed her to afford higher quality health care. In turn, improvements to her condition enabled her to perform longer streams on a more regular basis. In November 2020, Iron Mouse was announced as one of the charter members of V. Shoujo, a new U.S.-based agency of English-language VTubers, joining other streamers and personalities such as Eunice and Project Melody. Iron Mouse is known for her frequent collaborations with Welsh YouTuber C-Dog. He had learned of VTubers via Gigig, one of his colleagues on the Trash Taste podcast. After watching an Iron Mouse stream on Twitch out of curiosity and finding her to be really funny, C-Dog brought her up during a Trash Taste episode with Hololive English member Maury Calliope as a guest. The acknowledgement led to interest from Iron Mouse, who had also been following C-Dog via own streams. Her involvement began with a voice cameo in one of his videos, and later collaborative streams. C-Dog described himself in an interview with Dexa2 as the straight man to Iron Mouse's chaotic personality, while Iron Mouse has considered him genuine. In February 2022, Iron Mouse held a subathon event, a non-stop stream in which a countdown clock was extended whenever viewers purchased paid subscriptions or otherwise made donations to the channel. The stream remained online even when she was asleep, during which other content, such as videos, and appearances by her friends and other guests, were featured. Over the course of the event, which ran for a total of 31 days through the 7th of March 2022, Iron Mouse became the most subscribed to female streamer on Twitch, and had the largest number of active subscribers of all Twitch channels at the time, although short of an overall record set by Ludwig during a similar event he held in 2021, with nearly 172,000 subscribers in total by the end of the event. Iron Mouse has occasionally hosted a talk show Speak of the Devil which features various guests. According to data from Stream Elements and Rainmaker, Iron Mouse was the 8th most watched streamer on Twitch during the month of February 2022, marking the first time that a VTuber had made their monthly top 10. Discussing the event, Iron Mouse felt that it was the only time I didn't feel lonely because I felt like I had somebody there all the time. It was the least lonely I've ever felt in a long time. In March 2022, she was nominated for Best VTuber at the Streamer Awards. In December 2022, she was listed among the heroes on the Plasma Hero website for raising awareness about CVID and encouraging viewers to donate plasma. She has also received praise for encouraging donations to the Immune Deficiency Foundation (IDF), a charitable organization which helps people suffering from conditions like hers through research and improving the quality of life of people suffering from primary immunodeficiency. According to Streams charts, Iron Mouse was the second most watched female Twitch streamer of 2022, behind Amaranth. In March 2023, she won Best VTuber at the Streamer Awards. In June 2023, Iron Mouse held a second subathon event as a charity event, with half of all revenue from Twitch subscriptions and bits, as well as merchandise sales during the event, being donated to the Immune Deficiency Foundation. The subathon broke her previous record of 172,000 subscribers and set a new record of 205,461 subscribers. On the 7th of December 2023, Iron Mouse won the award for Content Creator of the Year at the Game Awards 2023, becoming the first VTuber to win in the category. In February 2024, she repeated as Best VTuber and was also nominated for Streamer of the Year at the Streamer Awards. On the 10th of September 2024, YouTube suspended Iron Mouse's VOD channel, supposedly due to copyright strikes. On the 20th of September, her main YouTube channel was also suspended. In response, she tweeted that she was incredibly sad and shocked. Both of Iron Mouse's YouTube channels were later reinstated on the 23rd of September. That same month, Iron Mouse overtook Kai Cenart as the most subscribed channel on Twitch, setting a new all-time record for the service on the 30th of September. Her record lasted until November 2024, when it was broken by Cenart. In December 2024, Iron Mouse once again won Best VTuber, and was also nominated for Best Marathon Stream and the Sapphire Award. Philanthropy and raising awareness. From early in her career, Iron Mouse has been keen on educating more people on CVID and PI. In an interview with Plasma Hero she said, "At the time, I think I was so worried I didn't realize how talking about it could raise awareness. I don't make my illness the main focus of my content, but I do speak about it from time to time for education and awareness and to explain why I may not be feeling my best at times." On the 4th of August 2021, she held a charity event for Immune Deficiency Foundation (IDF) and raised over $100K. This caused many creators like C-Dog Via to follow in her footsteps and raise more money for the charity. In an interview with the Immune Deficiency Foundation, C-Dog Thea stated, I find that often it's the people that we really care about who force us to learn about stuff we've been ignorant about or that we've allowed to be ignorant about because we haven't had to deal or be exposed to any of the ideas, acknowledging her role in educating him about pi and the Immune Deficiency Foundation. She also did a 30-day subathon in June 2023 and a 39-day subathon in September 2024, where she donated half of all the subscription income to the Immune Deficiency Foundation. Iron Mouse also has raised a significant amount of awareness for donations and the importance of plasma. She stated in an interview with Plasma Hero, I know so many people encourage blood donation, and I want to make sure I can reach as many people as I can to tell people about living with a pi and donating plasma. I want more people to know that we are here and we need support, but I also want people to know that they are not alone. She used her platform to encourage more people to donate plasma, and her efforts were well received as more people started to donate plasma, as she quoted in an interview with Dexa2. It's really nice to be able to see so many people tweet at me every time I donate plasma, which is something I never saw before. It's just really nice to see the reception that everyone has given me, and the fact that people wanna know more about it, and people wanna donate plasma, and people wanna help out because it's a rare disease, and not a lot of people know about it. Her efforts for raising awareness were also well recognized by the Immune Deficiency Foundation IDF, which earned her the Plasma Hero Award on 2024 Pi Conference. She is also artistically involved in raising awareness. On the 12th of June 2024, Iron Mouse released her single Carry On, which was the ending song for the Compromised Life Without Immunity documentary by the Immune Deficiency Foundation. Discography. Singles. Waifu Jam. 2023 Rodent's Kingdom, Devil, Carry On, Time to Feast, Cry For Me WAWAWA. 2024 Covers. Headless Angel, 2024, Goddess of Victory, Nick. Atonok, 2024, Dandadan. Filmography. Video Games. 2023, Smite, Persephone. 2024, Granblue Fantasy vs. Rising, Dormouse. Awards and Nominations. Streamy Awards, 2022, Best VTuber, nominated. 2023, Streamer of the Year, nominated. Best VTuber, nominated. 2023, The Game Awards, Content Creator of the Year, 1. 2021, The Streamer Awards, Best VTuber Streamer, nominated. 2022, Best VTuber, 1. 2022, Best Just Chatting Streamer, nominated. 2023, Streamer of the Year, nominated. 2023, Best VTuber, 1. 2024, The Sapphire Award, nominated. 2024, Best VTuber, 1. 2024, Best Marathon Stream, Iron Mouse Subathon 2024, nominated. 2023, The VTuber Awards, VTuber of the Year, 1. 2023, Miss VTuber, 1. 2023, Best Streamed Event, Iron Mouse Subathon 2023, 1. 2023, Best Concert Event, Candy Pop Explosion, nominated. 2024, VTuber of the Year, nominated. 2024, League of Their Own, 1. 2024, Best VTuber Event, Iron Mouse Subathon 3, nominated. Rolling Stone Magazine Interview. Iron Mouse is Twitch stock streamer, but she doesn't know why you're watching. The Puerto Rican VTuber took the all-time subscriber record from Kai Cenart during a marathon of charity streaming. by Christopher Cruz. The 10th of October 2024. Right now, the most subscribed to streamer on Twitch is Iron Mouse. To her 2.1 million followers, the cartoon-like Twitch witch with the high-pitched voice is their demon queen. For nearly 40 days, Iron Mouse has been on a mission, an ongoing subathon, a series of marathon streams held to raise a certain number of subscribers, and on the 30th of September, she broke the all-time record of over 312,000 subs, taking the crown from Twitch superstar Kai Cenart. Early Thursday morning, the subathon officially ended with her record standing at over 326,252 all-time peak subs. Iron Mouse put a punctuation mark on a historic Twitch moment with 3 renditions of classic ballads like Frank Sinatra's My Way. This is just the latest milestone in the rapid ascension for the Puerto Rican streamer. After beginning to stream in 2017, she became a founding member of the VTuber group VShojo in 2020. Using her platform, she's worked as an advocate to bring awareness to immunodeficiency disorders, herself afflicted by common variable immunodeficiency. Her condition makes it difficult for her to travel, making the global reach of the Iron Mouse persona all the more important. Interviewer asked, "What was your initial reaction to breaking this all-time record?" Iron Mouse replied, "I honestly did not expect this to happen. I didn't even expect it to last a few days, let alone a week, let alone this amount of time. But my community is amazing, and they've been incredibly supportive and very, very kind. They are just wonderful. It's been a crazy month." Interviewer asked, "So, it kept extending as people continued subscribing. Was it difficult to suddenly find yourself needing to keep going and going?" Iron Mouse replied, "The first week is always the hardest. Once the week was over and we kept on going, I was like, okay, maybe we might make it. And then we started pushing to beat my record from last year, and the second we beat the record, I started thinking, okay, I wonder how far this is gonna go. I made a little bit of a joke, saying that I wanted to beat my friend Ludwig's record after I beat my own record. Then my community took it all the way, and it was just the most insane thing that has ever happened, and I am just extremely humbled and grateful. It's just been a dream." Interviewer asked, "You've played a lot of games on stream during this last month. What are you most hooked on still?" Iron Mouse replied, "I've been bitten by the horror bug to the point where I have to consume every horror game that's come out. It's been a bit of a problem, it's taking over my life. Silent Hill 2 just came out, and I've been playing it non-stop. And now October's here, and it's the perfect time. The perfect excuse. Everybody's like, Mouse, you already play horror games anyway. But it's extra horror now." Interviewer asked, "What was the deal with your YouTube channel? It was taken down during the subathon." Iron Mouse replied, "That was rough. I think that was the worst part of subathon, to wake up and find out that my channel was gone, and I was devastated and cried. I didn't think they were gonna come back, but then they did, and it was like Christmas." Interviewer asked, "Why did they take it down?" Iron Mouse replied, "Right now, I don't know if I can discuss at the moment. But when I do, we'll see." Interviewer asked, "Despite not traveling physically, you also attended TwitchCon remotely during the subathon. There were tweets showing you rolling around on a monitor screen talking to people. What was that like?" Iron Mouse replied, "Yeah, we went to TwitchCon. They were able to walk me around TwitchCon on a screen, and I could take chat around TwitchCon. It was really nice to be about to talk to community members while streaming." Interviewer asked, "Iron Mouse has no bounds. With the right tech, you can be anywhere. Iron Mouse replied. Yeah, I have a lot of wonderful friends that helped me see the world, and I'm very grateful to them, because if it wasn't for them, I don't think I'd be able to see all these amazing things. Interviewer asked. Tell me about the moments after breaking the all-time sub record. Iron Mouse replied. I cried a lot. It meant a lot to me because it's Hispanic Heritage Month, and I am Latina, and it meant a lot to me as a Latina. It meant a lot to me because I was the first YouTuber to do it, the first woman to do it, and it was just a lot of firsts. But also, what meant the most to me was that I did the subathon because I wanted to raise money for the Immune Deficiency Foundation, which is a charity that means a lot to me because of my immune condition. Interviewer asked. What kind of reception did you receive from the community? Iron Mouse replied. I saw so many nice things, and it's hard because I'm not prepared to read all those nice comments, all those nice words from people. I get very flustered, very overwhelmed, and very emotional when I do. I saw a lot of people mention, as a Latina, this means so much to me. And I saw a lot of comments from people saying, I have a chronic illness and this means a lot to me because I felt like my life was over, and I felt like I wasn't going to be able to do anything. To see you doing something inspires me to want to do stuff. Interviewer asked. That must feel good, to know that your success is inspiring other people with similar conditions. Iron Mouse replied. I want people to know that, just because you have a difficulty in life, and just because things might not go your way and you have a lot of hurdles, if you really want to do it, just try to do it your way. Try to make your dreams come true. Interviewer asked. But it's also a huge leap forward for VTubers, right? What kind of reactions do you see from others? Iron Mouse replied. I have people from the VTuber community who feel like this is a big step, to be seen. And I agree because we kind of have our own little bubble going on, and it's just nice that people are learning about what VTubers are and what we're about. I know it can be a little bit confusing to see, an anime girl on screen. What is that? What is happening here? But it helps making it a bit more normalized. Interviewer asked. What's the biggest misconceptions you see about VTubers? Iron Mouse replied. I get a lot of comments from people saying, is she real? Is she AI? Is she a robot? Is she a man? What is she? Is she a fictional character? I see a lot of fictional cartoon character stuff being thrown out there, so I think it's important for people to know that, there are some VTubers out there that could be AI, but I am not one of them. I am a real-life, human woman. And it's just a different way of streaming. Some people want to stream with a face cam, some people don't want to stream with a face cam. Some people want to be a character, some don't. It's just a different way to create content. Interviewer asked. What do you think fans are looking for when they tune into a VTuber? Iron Mouse replied. Some people just want escapism, and some people just want to see, funny, anime girl on the screen. But there's also a lot of people that are interested in my lore as a character, but also interested in me as a person. I think it's just different for everybody. There's not one right or wrong answer, it just depends on the person. And there's a lot of different reasons why people want to watch VTubers, just like there's a lot of different reasons why people watch streamers. It's because they want to find something that speaks to them and something that they can relate to. I think that's amazing. Interviewer asked. Some people, like Aiden Ross, responded negatively to you breaking the subscriber record and flat out mocked VTubing in general. Did you look at those kinds of reactions? Iron Mouse replied. There were a lot of streamers that were very, very supportive. It was heartwarming to see. There's always going to be negativity from certain spaces and places, but for the most part, creators have been amazingly kind to me and wonderful. There's always going to be people on the internet that are not going to understand what you're doing, and they're just not going to get it. Just confused. And that's okay. I'm more a positive person. I don't like to pay attention to people saying nasty things or mean things. I had to address my community because a lot of people were getting upset because they saw a lot of negative comments. Why were you feeling that way? Iron Mouse replied. At the time when I tweeted that, it was because a lot of people were coming in being like, "What are you watching this? Why would you watch this?" And I always answers with, "I don't know. I don't know why people watch me. I don't understand. And you know what? It's fine. I'm just happy that people do." When I first started, I just wanted to make friends. I started very small. I didn't expect any of this to work out. I just wanted to make friends and hang out on the internet. I figured, I'll just stream to a couple of friends, and that was it. Then just move on with my life. Then, everything started to pick up. The fact that I can take care of my family and take care of myself, and I began this amazing career. It's completely changed my life. I will be releasing a detailed video about CVID. Check out my channel. I will be releasing said video 1 week after this one. Out of respect for Iron Mouse, please donate plasma. In most cases, you can donate twice a week, and can get paid each time. Many places pay as little as $50 a week across 2 donations. Donated plasma isn't just used to treat illnesses, but can also be used for research. I read it is used in cancer research. A single dose of IV plasma medicine requires donations from more than 30 people, and cost as little as $10,000. But with more donations, perhaps more available product may reduce the cost, making it easier for people who need it to afford it.
Please excuse any mispronunciations by TTS. The English TTS has trouble with non-English words. But, if you watch Zentraya, you should be fine. As a result of YouTube's rules pertaining to links in descriptions, I will be adding site details to the video. According to the Immune Deficiency Foundation, the IDF is a charitable organization that supports people with primary immunodeficiency, or PI like CVID. Remember, you may be able to donate plasma to support the production of medicine for PI treatment, and research into potential treatments for various conditions. And if for some reason you can't donate plasma, that's understandable. Common Variable Immune Deficiency, CVID. Common Variable Immune Deficiency CVID, previously known as adult-onset hypogammaglobulinemia, is one of the most frequently diagnosed primary immunodeficiencies. It is characterized by low levels of serum antibodies, which cause an increased susceptibility to infection. Overview: CVID is a relatively frequent form of primary immunodeficiency, found in about 1 in 25,000 persons. This is the reason it is called common. The degree and type of deficiency of serum immunoglobulins, and the clinical course, varies from person to person, hence, the word variable. An additional characteristic is a decreased IgA/or IgM level, or a low level of all 3 major types of immunoglobulins, IgG, IgA, and IgM. In some individuals, there are defects of the T cells, and this may also contribute to increased susceptibility to infections as well as autoimmunity, granulomatous disease, and cancer. To be sure that CVID is the correct diagnosis, there must be evidence of a lack of specific antibodies, measured antibodies in response to vaccines. Other possible causes of these immunologic abnormalities, such as loss in the gastrointestinal tract or urine, must be excluded. Frequent and/or unusual infections may first occur during early childhood, adolescence, or adult life. As mentioned earlier, Some people with CVID also have an increased incidence of autoimmune or inflammatory conditions, granulomas, and an increased susceptibility to cancer, when compared to the general population. Sometimes, it is the presence of one of these other conditions that prompts an evaluation for CVID. Although CVID is a distinct diagnosis, some may confuse it with other antibody deficiencies. The medical terms for absent or low blood immunoglobulins are agammaglobulinemia and hypogammaglobulinemia, respectively. Due to the late onset of symptoms, other names that have been used in the past for CVID include acquired agammaglobulinemia or hypogammaglobulinemia, adult onset agammaglobulinemia or hypogammaglobulinemia, late onset agammaglobulinemia or hypogammaglobulinemia, dysgammaglobulinemia. The term acquired immunodeficiency refers to a syndrome caused by the human immunodeficiency virus, HIV, and should not be used for individuals with CVID, as these disorders are very different. Clinical features. Both males and females may have CVID. In many, the diagnosis is not made until the third or fourth decade of life. About 20% of people with CVID, however, have symptoms of the disease or are found to be immunodeficient in childhood. Because the antibody arm of defense, the humoral immune system, is slow to mature, the diagnosis of CVID is generally not made until after the age of 4. The usual presenting features of CVID are recurrent infections involving the ears, sinuses, bronchi, breathing tubes, and lungs, respiratory tract. When the lung infections are severe and occur repeatedly, permanent damage with widening and scarring of the airways, a condition termed bronchiectasis, may develop. The organisms most commonly found in sinus and lung infections are bacteria that are widespread in the population and that often cause pneumonia, Haemophilus influenza, Streptococcus pneumoniae, even in people who do not have CVID. The purpose of treatment of lung infections is to prevent their recurrence and to prevent the accompanying chronic and progressive damage to lung tissue. A regular cough in the morning and the production of yellow or green sputum, a mixture of saliva and mucus, may suggest the presence of chronic bronchitis or bronchiectasis. Individuals with CVID may also develop enlarged lymph nodes in the neck, chest, or abdomen. Enlarged lymph nodes may be caused by infection, an abnormal immune response, or both. Similarly, enlargement of the spleen is relatively common, as is enlargement of Peyer's patches, which are collections of lymphocytes in the walls of the intestine. In some cases, other collections of inflammatory cells called granuloma, comprised of white blood cells including monocytes and macrophages, can be found in the lungs, lymph nodes, liver, skin, or other organs. Granuloma may form in response to an infection, but the cause of their collection in tissues in CVID is not really known. Although people with CVID have depressed antibody responses and low levels of immunoglobulins in their blood, some of the antibodies they produce may attack their own tissues, autoantibodies. These autoantibodies may attack and destroy blood cells, like red cells, white cells, or platelets. Although, most individuals with CVID present first with recurrent bacterial infections, in about 20% of cases, the first manifestation of the immune deficiency is a finding of very low platelets in the blood, or less commonly, severe anemia due to destruction of red cells. Autoantibodies may also cause other diseases such as arthritis or endocrine disorders, like thyroid disease. Gastrointestinal GI complaints, such as abdominal pain, bloating, nausea, vomiting, diarrhea, and weight loss, can also be associated with CVID. Approximately 21% of people with CVID may have significant GI problems. Careful evaluation of the digestive organs may reveal a reduced ability to absorb fat, and certain sugars or inflammatory bowel disease. If a small biopsy of the bowel mucosa is obtained, characteristic changes may be seen. These changes are helpful in diagnosing the problem and treating it. In some people with digestive problems, the detection and eradication of infections due to bacteria, parasites, or viruses may help eliminate the GI symptoms. Some people with CVID, particularly those who have not received the ideal immunoglobulin, Ig replacement therapy, may also develop a painful inflammation of one or more joints. This condition is called polyarthritis. In the majority of these cases, the joint fluid, if tested, does not contain bacteria. To be certain that the arthritis is not caused by a treatable infection, the joint fluid may be removed by needle aspiration and studied for the presence of bacteria. In some instances, a bacterium called mycoplasma may be the cause and can be difficult to diagnose. The typical arthritis associated with CVID may involve the larger joints such as knees, ankles, elbows, and wrists. The smaller joints, like the finger joints, are more rarely affected. Symptoms of joint inflammation may disappear with adequate Ig replacement therapy and appropriate antibiotics. In some, however, arthritis may occur even when the individual is receiving adequate Ig replacement therapy. Finally, people with CVID may have an increased risk of cancer, especially cancer of the lymphoid system or possibly the gastrointestinal tract. However, in a recent study of cancer incidence of people with PI enrolled in the United States Immunodeficiency Network, USIDNET patient registry, of the 4 most common malignancies in men and women, lung, colon, breast, and prostate cancers, there was no significant increase of these cancers in people with PI versus the age-adjusted population. Diagnosing CVID should be suspected in children or adults who have a history of recurrent bacterial infections involving ears, sinuses, bronchi, and lungs. The characteristic laboratory features include low levels of serum immunoglobulins, including IgG, often IgA, and sometimes IgM. Another part of the diagnosis of CVID is to determine if there is a lack of functional antibody. This is done by measuring serum levels of antibodies that are specific to vaccine antigens, such as tetanus, diphtheria, or pneumococcal polysaccharide. People with CVID have very low or absent antibody levels to most of these vaccines. Immunization with killed vaccines is used to measure antibody function, and this functional testing is crucial prior to beginning treatment. These tests also help the healthcare providers decide if the individual will benefit from Ig replacement therapy and are often essential in obtaining insurance authorization for this therapy. The number of B and T lymphocytes may also be determined, and their function can be tested in laboratories. Recent studies have also shown that examining the maturity of the B cells in the blood by looking at the surface receptors, B cell memory markers, can help in predicting the relative severity of the immune deficiency. Genetics and inheritance. People with CVID usually have normal numbers of the cells that produce antibody, B cells, but these cells fail to undergo normal maturation into plasma cells, the cells capable of making the different types of immunoglobulins and antibodies for the bloodstream and secretions. The genetic causes of CVID are largely unknown, although recent studies have shown the involvement of an increasing number of genes in select people. These include genes that regulate immune functions, B cell surface proteins that help cells signal properly when a foreign substance is identified, and genes important in B cells activation. Until recently, the majority of the genes identified caused autosomal recessive CVID, but increasingly autosomal dominant inheritance has been reported, one copy of an abnormal gene leading to variable expression. In these cases, other family members with the same genetic abnormality may not have any medical symptoms. As these are very rare gene defects, for the most part, genetic testing is not required for most individuals with CVID, particularly in those with inflammatory or autoimmune complications. However, genetic studies have been helpful in guiding additional individualized therapies. Treatment. The treatment of CVID is similar to that of other disorders with low levels of serum immunoglobulins. In the absence of a significant T lymphocyte defect or organ damage, Ig replacement therapy almost always brings improvement in symptoms. Immunoglobulin is extracted from a large pool of human plasma. It consists mostly of IgG and contains all the important antibodies present in the normal population. People with chronic sinusitis or chronic lung disease may also require long-term treatment with broad-spectrum antibiotics. If mycoplasma or other chronic infections are suspected, antibiotics specific for those organisms may be indicated. If bronchiectasis has developed, a daily pulmonary regimen, chest physiotherapy and postural drainage may be needed to mobilize the secretions from the lungs and bronchi and make them easier to cough up. When individuals with COVID are on Ig replacement therapy, routine immunizations are not required because the Ig solutions contain protective antibodies against these. Exceptions may be the new killed shingles vaccine, the human papillomavirus vaccine, HPV, and the annual viral influenza vaccine. Those with GI symptoms and malabsorption should be evaluated for the presence of Giardia lamblia, rotavirus, Campylobacter, norovirus, bacterial overgrowth, and other GI infections. In some cases, inflammatory bowel disease is found. This is an autoimmune condition that can be treated by the medications normally prescribed for individuals who are not immunodeficient, including the newer biologic drugs. Maintaining a balance between the immunosuppression used to control the autoimmune process while avoiding compounding the defects of the underlying PI requires close cooperation between the individual and the various specialists involved in their care. If autoimmune or inflammatory disease, granulomas, or tumors develop, the treatment is usually the same as would be given to a person with a normal immune system. When people with COVID, however, have these complications, there is a tendency for them to be less responsive to therapy. Regular checkups, including lung function, are recommended. Most individuals with COVID carry out most, if not all, normal activities. Regularly scheduled and careful follow-up is still mandatory as new problems may arise or evolve over time. In general, those who are stable are seen at least yearly, but with added questions or when other conditions arise, shorter intervals, such as 3 to 6 months, are needed. In addition to addressing routine questions and checking blood counts, metabolic panels, and Ig levels, monitoring for weight changes is important, as Ig doses may need to be adjusted. There is no current consensus on how best to monitor for lung disease. Chest X-rays are not able to show the same level of detail as a CT scan, but there is a lower radiation exposure with a chest X-ray. For more frequent follow-up of those with chronic cough and/or known lung damage, complete lung functions, including carbon monoxide diffusion, is useful, with possible chest CT at 3 to 4 year intervals. Monitoring for autoimmunity is usually accomplished through routine blood counts and general medical oversight, which will reveal characteristic symptoms. GI diseases will be similarly evident with complaints of diarrhea and, often, weight loss. Routine endoscopy is not required, although people with suggestive GI symptoms should have appropriate upper and/or lower endoscopy, colonoscopy with examination for H. pylori, pathogenic bacteria or viruses, or other mucosal changes. Loss of height may reflect loss of bone density. This requires attention to vitamin D, calcium, and other standard therapies. Evaluation of enlarged lymph nodes is not simple. When new lymph nodes appear and persist, biopsy may be required, but most commonly, these reflect simply reactive changes that are not clinically significant. Expectations. Ig replacement therapy combined with antibiotic therapy has greatly improved the outlook of people with COVID. The aim of the treatment is to keep the individual free of infections and to prevent the development of chronic inflammatory changes in tissues. The outlook for people with COVID depends on how much damage has occurred to lungs or other organs before the diagnosis is made and treatment Ig replacement therapy started, as well as how successfully infections can be prevented in the future by using these therapies. The development of autoimmune disease, inflammatory problems, granulomas, and/or malignancy can have a significant impact on the quality of life. These diagnoses often require additional therapies.